Hey everyone, let's dive into a topic that's probably popped up in your doctor's office or maybe even at the dinner table. Baby aspirin for prevention. Should you take a daily low dose aspirin if you're healthy? Or maybe if you've already got heart disease? There's a ton of new research, so let's break it down. First up, what is baby aspirin? It's just a low dose, usually 81 milligrams of regular aspirin known for thinning the blood and reducing clot risk. For decades, folks have been told to take it to prevent heart attacks and strokes. But is that advice still good? A big study, the Aspirin trial published in 2018, looked at healthy adults over 70. They found that taking daily aspirin didn't lower the risk of heart attacks or stroke, but it did increase serious bleeding. That's a red flag for using baby aspirin if you're otherwise healthy. Next, the 2022 guidelines from the U.S. Preventive Services Task Force came out strong. For most adults without heart disease, the risks of regular aspirin, mainly bleeding, often outweigh the benefits. They say if you haven't had a heart attack or stroke, think twice before starting baby aspirin. But what about folks who already have heart disease? Here's where things get clearer. Expert panels like the American College of Cardiology still recommend low-dose aspirin for people who've already had a heart attack or certain types of stroke because for them, the benefits really do beat the risks. All right, let's get some expert opinions. I checked in on what board-certified doctors are saying.
Who should be on aspirin? You have to break it down into two categories. So there's primary prevention and then there's secondary prevention. So what are these things? So primary prevention are people that really don't have any cardiac disease, any heart disease, they don't have stents, or any diseases like stroke that they need to be on aspirin for. And the second category is secondary prevention. And those are people that do have these diseases. So somebody that has had a stroke, somebody that does have stents, somebody that has had significant heart disease. And the data behind these two conditions and who should be on aspirin and who shouldn't is actually quite different. Peter, what's your experience with this?
Well, I mean, you just kind of summarized all of my patients with the, secondary prevention. And so I think the bigger picture and probably why we decided to talk about aspirin.
Sorry, Peter, but have you heard of aspirin, or is that?
No. Well, I know how to give it. I know that you probably don't know how to prescribe it. But,
all right.
So I would say this is that we gave aspirin out to everyone. I hate to say it like candy, but everyone who saw a cardiologist can relate that probably got aspirin thrown on board, right? And so over the age of 50 primarily, I mean, if you had like a sibling, brother, parent, great-grandparent on like your mom's side or dad's mother's side. Yeah, or maybe like you had a pet who had heart disease, you probably ended up on baby aspirin. And so I don't know if that's, you guys saw that. I deal with more secondary prevention. So, for all of you who don't know, I'm a cardiologist. So, this is really in my realm. But.
Absolutely. And of course, you have that tremendous experience. I mean, primarily we see aspirin prescribed, and questions we get are, should we take aspirin for primary prevention? A little bit of history. I mean, it's been around forever. We're talking about, I think, 1890, so 125 years ago when this drug was first invented. And in my mind, I tend to distinguish between drugs like that, which have been tested, so many people tested might not be the right word, but prescribed for decades and are not making a ton of money now versus a lot of the more shadier big pharma drugs, shall we say. And aspirin has been used for a very long time. I mean, the data, we have to look at a number called number needed to treat when we are thinking about benefits. So that means how many people, this could apply even to an injection. I wish we'd talked about this more during the pandemic, but how many people need to be prescribed a drug or an injection to experience a benefit? Do you want to get more into number needed to treat, Ben?
Yeah, so number needed to treat. So it's very different, again, when you're breaking those people down into those two categories. So primary prevention as opposed to secondary prevention. So let's think about primary. So those are, you may have gone to your doctor's office and they said, hey, you have a family history, maybe we should get you on an aspirin. So that's when these numbers become very important. So you don't have heart disease, you don't have a stroke, and the number needed to treat is quite high. I think it's 200 to 300, correct, patients?
Yeah, 200 to 300.
To reduce the risk of one patient having heart disease for primary prevention, again, if you don't have disease. Now, those numbers are pretty high, and let's not forget that comes with side effects. And let me talk to you a little bit about what those side effects might be, just one of them in particular. And those with aspirin are predominantly bleeding. So when we talk about bleeding, it would be in your gastrointestinal tract.
Very common, yeah.
And that is not unheard of.
What are some things, Ben, that you would screen for as a primary care before you start someone on aspirin?
So you'd have to know a few things. So one, I have to know if they're taking other drugs that might increase the risk of bleeding. So that's a blood thinner. Now, it doesn't mean you can't take aspirin, but we got to talk about it. Two is if you're drinking alcohol very regularly, that could be a problem. It can irritate your stomach lining. Three, are you taking things like ibuprofen that can irritate your stomach lining? And the other things we want to check is we need to know what your platelets are, right? So aspirin deactivates platelets, and those are used to kind of make clots and things like that in your body to stop bleeding. The other thing is I'd need to know if you were anemic. Are your red blood cells too low?
Yeah, you don't want to take that extra risk.
Do you want to knock it down more?
Great point. What you said there about so many people now, and this is important because a lot of studies don't actually include people with certain risk factors who are on medicines, but many people I see now are on aspirin, they're on clopidogrel, also known as Plavix, and they're also on another blood thinner, perhaps like apixaban, which is known as Eliquis, rivaroxaban, or even warfarin, because they've got other things. They may have had blood clots before. And that all will increase the risk of bleeding on aspirin.
Yeah.
There's a difference between a healthy person taking aspirin and somebody who already has had something happen to them, where there's much more benefit potentially of taking aspirin. And I will say again, you cannot beat lifestyle. You can basically lifestyle if you have suboptimal tick boxes, whether it's diet, exercise, stress, work on those. That will always bring more for benefit and an anti-inflammatory effect. And the other caveat that I'd like to add, I'm speaking for more than 30 seconds, by the way, but aspirin doesn't have to be all or nothing like any drug. You could take it twice a week or 3 times a week. I have lots of family members who don't want to take it every day because they're concerned about potential risk. And by the way, we're talking about the low dose aspirin, because high dose actually doesn't have more benefits necessarily than low dose. But frequently I've said to them, well, why don't you just take it twice a week or 3 times a week? I mean, it's over the counter. It's not like being on a prescription. So those would be my thoughts.
Yeah, I think, he covered a lot. He covered a lot of what I was going to say. So thank you. You left me with very little. But the one thing I'd say is side effects. So you have to be very careful with what you're taking with aspirin. So if you're on an aspirin, you have to be very careful, like I said, with alcohol. You have to be careful if you're going to take ibuprofen and things like that for joint pain. If you're on a blood thinner, you have to speak with your doctor about potentially how these are going to work together, and you have to be monitoring that. So that would be my big things when it comes to aspirin.
That's so true. I mean, I'll finish up because I am the cardiologist here, and I probably know a lot more than you guys just in general. But
we're gonna debate this after.
Yeah, we'll have another debate. That's highly unlikely.
Everything here is a risk benefit, and I think that's the most important thing to leave here with most medical. With medications and actually most procedures and everything in medicine, it comes down to risk benefit. That's something that as patients people need to learn how to maybe talk to their doctor about the risk benefit. Really quickly, aspirin, we say people wonder why baby aspirin. I mean, the most effective dose of aspirin was 70 milligrams. So as we go up on the dose of aspirin, as well as any other medication, the adverse effects go up. So there's a 3 to 5-fold risk of going from a baby aspirin, which is 81 milligrams in the United States, to an adult strength, 325. So my final verdict on aspirin, aspirin definitely has its role. I definitely support the use of aspirin in secondary prevention. Doctors, healthcare providers don't ever want to be the person to stop aspirin on someone, or sometimes even start it, because they're always worried about the risk of bleeding or the risk of taking off it. So you really have to have that talk, with your with your provider or your doctor, whoever's taking care of you, to really decide what's best for you.
Dr. Rachel Bond, a preventive cardiologist, says aspirin can be life-saving after a heart event, but for the average healthy adult, it may cause more harm than good. Dr. John Mandrola, an electrophysiologist, adds, we used to think aspirin was a freebie, but now we know better. And Dr. Elizabeth Clodas, a board-certified cardiologist, emphasizes it's all about individual risk. Never assume aspirin is right for you without a personalized discussion. So what's my take? If you're healthy, don't start baby aspirin just because you read it online. But if you've had a heart attack or stroke, talk to your doctor about whether you should keep taking it. Bottom line, this isn't a one-size-fits-all situation. Stay curious, stay informed, and always chat with your doc before making big changes. Thanks for tuning in. Your health is worth the extra thought.